Oh, yes, good afternoon. I want to talk a little bit about making an assessment with the DSM and some of the techniques that you can use to do it. Usually, when the client come in, the first thing that's going to happen is that they're going to have what's known as an intake form. Okay, so what does an intake form look like? So when you're doing the intake form, whether it's a adolescent or an adult, you want to make sure that it has as much pertinent information that you're going to be gathering. Okay, and the intake form, of course, is done when the client first comes into your office. As a school counselor, you might want to do an intake form just so you can keep a record on which students you're seeing and why you think you're going to be seeing them. But that's not always the case. It also depends on the school district that you're going to be working with, right? So, but for the most part, when you're working in a clinic, what you usually do is a intake form. So right now, I'm going to kind of show you an example of what an intake form looks like. Now, this is not universal for all intake forms, but it's kind of like an example. Okay, so let's see if we can get this up and running. But one of the things you want to get is, like I said, most pertinent information that's going to be dealing with the issue that you're going to be seeing this client for. Okay. Some of the things is that you want to make sure that if they're adolescent, depending on the jurisdiction, if they're under the age of 16, they can't really give consent. So if they're over age 16, depending on the jurisdiction, they can give consent, and you won't need a parent or guardian signature. But most places at 16 or under, you're going to need a parent or a guardian signature for them to actually receive services from you. So that's something that you want to look at. Okay. So when you see here, there's the child's name, date of birth, the age, the school attending, and grade level is applicable. On child live with both biological parents or other. If the parents are divorced, describe the custody arrangements, emergency contact, phone, and then as it goes on down here, it gives information about the parents, any legal issue the child might be involved in, and then as you come on down, you get into what is the presenting problem. The presenting problem is usually what is bringing the client to see you, the student to see you. But the thing is that that is not always going to be the pertinent issue. Sometimes symptoms are the things that people try to get addressed, but the underlying issue causes the symptoms. So there's some of the things you're going to look at, some of the problem areas. You want the student or the client or even their guardian to check off everything that's applicable. And as you go through, you kind of see that you're kind of picking up on different things. And it's similar with adults. Here, client intake form, you want them to answer questions like what are their spiritual and religious affiliations, how often do they attend religious services. And one of the reasons this is very important is because of the fact that in a lot of cultures, religion, spirituality is what I will call, and what the field call, protective factors. They help a client to be resilient, so you can use these things as strengths for the client to be able to look into. You can also look at what might be causing other issues like depression or a crisis in faith and different things like that. So you see, does your spiritual or religious affiliation provide supportive network for you? And so it's like those are the kind of things that you're going to be looking for. So when you're doing that, once you get that done, right, what's going to happen then is that you're going to look into actually using the DSM as a assessment tool. So while you're doing counseling, you're pulling out things and getting a theme and different things like that. Even with the intake, you're going to get a theory on what you think is going on with that client. And based off that theory, you're going to come up with an initial assessment, an initial diagnosis. And when you come up with that initial assessment, that initial diagnosis, then you're going to start seeing and asking questions and following through to see how well that client is going to fit that criteria. So let me give you an example. Let's say it's dealing with alcohol related issues, right? So the first thing you're going to do is you're going to go to your old trusty DSM 5 like we have here, right? So your DSM 5, you're going to get to DSM 5, and then once you get to DSM 5, you're going to move on to the different issues. So what you want to do, what you want to do is, let me see here. So what you want to do is get to find out where they meet the criteria. So now what you're going to do is you're going to look at the criteria. So with alcohol related disorders, as you look at it, you look at alcohol use disorder, alcohol intoxication, alcohol withdrawal, other alcohol induced disorders, and unspecified alcohol related. So what you're going to do is you're going to look at a problematic pattern of alcohol use leading to clinical significant impairment or distress as manifested by at least two of the following occurring within a 12-month period. So what you're going to do is you're going to look at these diagnostic criteria, and if the client come in and you got a suspicion as alcohol-related disorder, you're going to focus a lot of your attention as far as your probes and your investigation and your questioning with the client to find out as much information you can to see if they meet this criteria. So they got to meet at least two. So the thing is, the more they meet, the better it is. Okay. So as they meet these criteria, what you're going to do is you're going to look into specifying whether it's early remission, a sustained remission, if specified they're in a controlled environment. So you're going to do these types of things for your diagnosis. Okay. So first you're going to make an assessment to see where the client's standing and how well they meet these criteria. So once you do that, then it's easier to verify and once you verify with making sure they meet this criteria. So what you're going to do is you're going to come up with a theory when you meet the client, uh, have a client probe, investigate, counsel the client, question to see how many of these do they make, right? So you're going to find out what type of drinking they doing, how often they drink, how long they've been drinking, have they had anything like blackouts or any kind of legal issues dealing with drinking, what's their tolerance level, so like any physically hazardous things. So it's like that's what you're going to do. So you're going to meet this, see if this criteria meet, and once you do that, then you'll be able to actually diagnose them with the alcohol related issue. Okay, so that would be their disorder. So that's how you would do that. And you would do that with any type of disorder in the DSM. You will use the DSM as your standard as far as do they meet the criteria that's laid out for that disorder. And as you're doing counseling, you're making your assessment, that's what you'll do. So now there are tests and assessments, physical assessments that you can use to try to pick up just about any disorder that you will want. Now it also depends on where you're getting your assessments and different things like that. Like, for example, depression. One of the things you want to do is do a screener with that depression inventory, the BDI. So you can use that as a screener to see is there any issues that you might need to look up and try to make sure that they're not having depression issues. Okay. The Beck anxiety inventory. So you might want the BAI. You want to look at see if you have any anxiety or anything like that. So it's like there are different instruments. And see, the thing is that if you're in a school, they have different things like the BAS, right? Where you learn about the behavioral issues the student have. You can look into things like ADHD with this, what type of studying patterns they have. And so that's the type of information that you will look for. Okay. Now, usually school counselors do not make diagnoses, but it's very important that you know where to go and how to look up the criteria. Okay. But clinical counselors, you will be making diagnoses. It's very important that you know how to back up your claim, your theory on this disorder that they might have. So the things that you're having doing in counseling should help you verify and substantiate why you have that diagnosis for that individual. Okay, so I want to thank you for watching this small quick video, and be on the lookout for the next video. Thank you.